Hello and welcome to this Facebook Live discussion on BBC Africa. COVID-19 remains one of the biggest health challenges in the world today. And today we ask, what is it like to suffer from this coronavirus? I am Anne Soy.
And I'm Bonnie Tunya. Good afternoon or good morning from wherever you're watching us from. But let's just start. I mean, there's been a lot of information coming out about COVID-19 and how we're covering it. As a journalist, obviously consuming a lot, what are the three things that jump out for you as far as corona goes?
Well, the number of cases across Africa has been rising, more than 9,000 across the continent now. And obviously, South Africa is leading in that tally with more than 1,600. And we have seen that countries are ramping up testing. South Africa has announced that it is now going to the community and mass screening people. If you have symptoms, then you're tested. They've already mobilized mobile laboratories for that.
Interesting. I was just looking at the numbers as well. Obviously, for me, interesting would be countries that have no cases. So looking at Comoros, Western Sahara, Sao Tome and Principe, Lesotho as well, 0 cases. Obviously, they're wondering what we're all panicking about.
And they've already taken measures to restrict movement into their countries. And, you know, just talking about ramping up testing of cases, you know, as we speak, Ghana is waiting for 15,000 test results. So they have tested more than 15,000 people. These are contacts of confirmed cases, and they're just going out there, mass identifying people to try and see who tests positive. And the results will then inform their next course of action.
And also it's interesting, and sorry, the more the tests, the more cases we'll see, right?
Absolutely, and that is why they're saying that these cases are going to increase, at least in the short term. The other country that has done the same is Ghana. They are currently at more than 600 cases so far. A big jump over the weekend. I think there are 658 at the moment. Big jump of more than 150 over the weekend. And it's because they went and mass tested contacts of confirmed cases. And you know what? 200 people out of these, all these people tested positive, but they don't have symptoms.
Interesting. Worth noting, and perhaps a sigh of good, some sense of good news, if you look at Egypt, and 247 people have recovered. So, I mean, perhaps the biggest number we're seeing in Africa. I know a lot of medical practitioners have been saying all hope is not lost. People can recover from this, and I think Egypt is a good example of that.
Indeed.
Right, so let's move on. Later on this program, we'll be joined by Anita, Asamoah, a public health epidemiology researcher at the University of Ghana. But also joining us right now is Professor Rina Shah, who is the head of infectious diseases at the Aga Khan University Hospital in Nairobi. Professor Reena has been treating COVID-19 patients.
Now, let's take a scenario. You have followed the instructions to the letter, washing your hands, sanitizing when it's needed. You have tried not to touch your face, coughed into the elbow so that you have kept yourself and others safe. You even wore a mask. But after you've observed all this precaution, you still found yourself with the illness that the world is talking about. So we ask, what next?
Right, and this is a question that should concern us all. By the time that we are coming on this Facebook Live, there are about 51 African countries with confirmed cases of the coronavirus. Now, the total number of people in the continent with COVID-19 stands at 9,300. The spread of the virus is unprecedented in both scale and severity. Now, numbers keep rising, and so does the question, will I be the next one? And if it is the case, then what should I do? We have experts taking these questions, so please do send them on the comments section below.
And to help answer some of these questions, we're joined by Dr. Rina Shah from the Aga Khan University Hospital here in Nairobi. You have treated some of the COVID-19 patients who have come to your hospital here in Kenya. Just take us through the atmosphere in the wards right now and even in the intensive care unit. How has it been?
Hi, good afternoon, everybody.
Good afternoon.
I must start by saying that if you do get the coronavirus, 80% of patients have asymptomatic or mild disease and don't need to come to hospital. And with all that fear, I think that's a figure you must keep in mind, that not everybody ends up in critical care. So 80 to 85% of patients are mildly symptomatic or asymptomatic and are managed at home. Of the ones that come to hospital, and usually the ones that come to hospital are the ones that have severe disease and cannot maintain their oxygen saturation. So the virus spreads to their lungs and they're not able to maintain their oxygen exchange. And we measure their oxygen saturation. If that goes low, these are the patients that get admitted to hospital. So out of the remaining 15 to 20% who do need hospitalization, 10 to 15% are admitted to the ward. It's only 5% that end up in the critical care area needing ventilation. Of the 5 to 10% that are in the ward, we give them oxygen, we give them, if they need, antibiotics, and majority of them do very well. I mean, we've had people who've recovered from the disease, not requiring critical care. We've managed them in the wards, managed their other conditions, like if they have diabetes, if they have kidney disease, we manage that. We supportively give them supportive care with fluids, and they do well. The remaining 5% that go to the critical care into the ICU need what we call ventilatory support. So that means that the oxygen that we give them does not support their lungs enough, the oxygenation. So their lung function needs to be taken over by a ventilator. So we take them to the ICU or the critical care area and intubate them and let a ventilator take over the mechanism of the lung. Of these, also, we've had recoveries. Patients have recovered from that and are doing very well. Unfortunately, we've had one mortality. That was the first mortality we had in Kenya. But we also find that it's the elderly and patients with other comorbid conditions that do worse than the average person. So what I'm trying to say is if you're 50 and you don't have another condition, you don't do as badly as if you're 50 and you have another comorbid conditions. By comorbid conditions, I talk about conditions such as heart disease, diabetes is the main one, kidney disease. So that is our experience. Sorry.
Professor, just to be clear, is this data from Asia, for example, where we saw that people who are advanced in age were more susceptible or had worse outcomes, many of them ending up in the ICU, a good number of them losing their lives. The demographics are different in Africa. Are you seeing any differences in those trends?
So we are early in the curve of the epidemic. So the patients we've had, majority of our patients are above the age of 50. And the ones that are coming in have other conditions. So majority of them also have diabetes. We've had one patient with HIV and diabetes. So it seems like it's following the curve in the rest of the world, but maybe a little bit younger than what they've seen elsewhere. The patients we've admitted without other comorbids have a very mild disease, and they do really well. I mean, the repeat PCR, the repeat test becomes negative in about 7 to 10 days, and we're ending up discharging them from hospital. So it seems we are at the moment following the curve of China and Europe, but we're just waiting and watching, because as the community spread increases, time will tell us what we will see in Africa, and especially within our HIV population.
Right. We're now joined by Anita, our other guest from Ghana. And just before we come to Anita, just one more question for you, Professor. So of the people who do not develop symptoms, even though they test positive for COVID-19, some of them are being advised to stay at home. And what then do they do at home to ensure other people do not get infection?
Yeah, so that's a really good question. The first thing you have to do is make sure you don't infect anybody else. So that we recommend that they stay at home, if possible, isolate themselves in their own room, in their own bedroom. Wear a mask if there is going to be any interaction with anyone, but that's important, you don't infect anyone. Make sure you hydrate yourself well. Make sure you eat well. If you have aches and pains, but a lot of patients do take paracetamol. If you have a cough, have symptomatic treatment. But the most important thing is hydrate yourself and try and do a little bit of exercise in your room. I mean, it can be difficult to be in a room for such a long period on your own, and you isolate yourself for 14 days. I mean, that is a recommendation. So wear your mask, isolate yourself, stay at home. Right. If you have other conditions, then you also have to speak to your doctor on phone. So if you're asymptomatic but you have diabetes, you need to monitor that very well as well.
Right. And Doctor, we'll get back to asymptomatic patients, but let's just bring in Anita joining us from Ghana. Anita, now, I mean, there's many people are worried now about this infection and the rise in the continent, but what should one expect once they find out that they have the virus?
Psychologically, it's very traumatizing in the first place. But when you find out you have the virus or you have a flu-like symptom, the first thing is you call the hotline numbers or you report to a nearby facility, which is the best thing to do so that you could be isolated and tested then before you are confirmed to be a confirmed case.
And Anita, I mean, everybody has been talking about the fact that Africa has a large youth population as perhaps a blessing in disguise. Are you observing that trend, and is it something that we can start reaping as far as this infection goes?
Yeah, we have the youths, but then the coronavirus is not a respecter of your age. It's killing the young, the old, excepting for the case of children we've not really heard about. But you being a youth doesn't mean you can't have the virus, or you can't. It can't get so severe when you're infected. It doesn't also mean that it's only the older people that are very high risk. The only issue is, except probably you have an underlying medical problem, fine, that's a greater risk. But it doesn't mean the youth are, exempted from having the virus.
Mm-hmm.
And Anita, we've just been, President Nana Akufo-Addo spoke last night in Ghana and talked about 15,000 people who have been traced, who are contacts of confirmed cases, who have now been tested. I just want to hear your comments about the strategy that Ghana is taking, and are people cooperating? Because, you know, without the cooperation of the community, any strategy will not work. Are people buying into these strategies?
Oh yes, most people are buying into it. The lockdown, the partial lockdown has been on for 2 weeks now, and people are staying home. But then too, I think more awareness needs to be made. Some of the locals don't really even believe the virus is here with us. They are not complying with the social distancing. And with the contact tracing, I think they are doing very well. Ghana Health Service is doing very well. And they did some mass testing for the Ayawaso West constituency last week. And I'm sure they're still on it. But then this week, I think we are in for the West. This result and are incoming, and probably we have a greater number of people confirmed to have the virus.
Right. So, well,
yeah, we have
questions,
lots
right?
of questions, and
yeah.
Lots of questions from viewers across Africa. Let me start off with this question coming from Andy Cotton in Lilongwe, Malawi, and they ask, if a person was tested positive for coronavirus and recently recovered from it, can he or she have some disorders emanating from that virus? I guess the question was side effect or side they're calling it disorders coming from that, Dr. Shah.
I'm trying to, so per se with the virus, you know, patients recover, they recover okay. Unless they have severe disease, when patients have severe disease and they're intubated and they go to ICU, then we know that they may get some long-term lung issues. But for the patients who are not admitted and have mild disease and recover, we haven't found any long-term issues yet.
All right. Great. And perhaps let me just throw in another question that comes from Emmanuel Ada from Nigeria, and is asking, how factual is the spread of the virus in the continent in Africa in terms of how are they managing the virus that the rapid death record in Europe are not being able to? I guess he's comparing the infection rate and the death rate in Europe compared to Africa. Perhaps, Anita, you want to take that?
Yeah, I think in Africa here, we're a bit proactive. You know, in West Africa here, the borders have been closed. Benin, Togo, Ghana here too. And I think that's helping a lot because there's no coming in, there's no going out. And people are adhering to the social distancing and using the mask. You see them when you go to town, even though there's a partial lockdown, the essential workers, you see them using the mask, and people on the streets, you see them using the mask. So I think in West Africa, although people are saying maybe the weather is helpful to us, but I'm not too sure. I mean, it's not scientifically proven. So we don't know about that. But compared to maybe Italy or Europe, I think we don't have the facility, advanced healthcare facilities, but I think we are on course and we are going to get there.
All right. Perhaps let me just throw in a question from Talib Mutongi. Dr. Shah, perhaps you could take this. And Talib is asking, what is the best drug for alleviating effects of the virus?
So currently there is no known therapy. I mean, there's been lots in the media about hydroxychloroquine after the US media. So it's all in trials. There is no drug at the moment that we can say that you take this drug and the patient will do well. In fact, our Kenyan guidelines, we're only recommending medication if you're in hospital. So, moderate to severe disease, nothing for the mild asymptomatic disease.
And there's a question from Talib, or rather Mbabazi Alfred, and I think I'll put this question to Anita. Despite the total lockdown that we've seen in some countries, what else can be done for the continent to be safe? Anita, would you like to take that one? Well, it seems we have...
Hello?
Yes.
Yes, Anita. So Mbabazi is asking, apart from the lockdown, the restriction of movement that we're seeing a number of countries have implemented, what else can the continent do to stop the spread of COVID-19?
Yes.
Okay, it looks like the line is not, we'll just try and sort out the technical issues.
Yeah.
Professor, we'll come back to you now. You talked about the demographics, and here in Kenya, we know that a 6-year-old child died from COVID-19. He may not have come to your hospital, the Aga Khan University Hospital, but would you like to just comment about, there are people who feel I am fit, I am young, and therefore I'm not in that demographic that's at risk, and therefore I can afford to go out, to defy some of the advice that I'm being given. Is there a risk to that?
So yeah, so you're fit and young. So there's two things. No man is an island. So you're forever interacting with other people. So you may be fit and young, and you interact with your parents and your grandparents. So if you do get the virus, you can transmit it to your parents and grandparents. So you have to stay at home to keep your family safe. That's the first reason. The second reason is you could, even if you're young, have another condition that you may not know about. Sometimes a lot of these, you may be walking around with HIV or diabetes or kidney disease, and you don't know about that. So you are at risk. So I think it's, as a good citizen, you must do social distancing and stay away from people. At least now, when we're waiting for the surge in a lot of these countries, this is the crucial time. Everyone should stay at home and social distance.
Thank you very much, Professor. We'll still come back to you. So currently, there are over 1 million coronavirus cases in the world. Sometimes you can get lost in the numbers. So let's hear from one person who has suffered from COVID-19 and is now healed. Yvonne Mugure is a Kenyan living in the United States, and this is her story.
Hi, I'm Yvonne, and I tested positive for COVID-19, and I was rushed to the hospital because I could not breathe. I had really severe shortness of breath, and when I got there, they found out that I had pneumonia in my lungs. So I was in the hospital for 4 days, and while I was in the hospital, I got antibiotics to treat the pneumonia because I had fluid in my lungs. And I also got shots in my stomach to stop any blood clot that I may have. So after I left the hospital, my journey has not been too bad. It hasn't been great, but I will say the worst was the hospital. Since the hospital, I have since regained my sense of smell and taste, which I had lost due to the virus. I've also been treating myself. When I left the hospital, I wasn't given any medication. I wasn't given any advice. I was just told necessarily just go home and get some rest, and the virus will take care of itself. So as of now, I still have the virus until I get tested again in 4 days. To heal, I have been drinking a lot of lemon and ginger tea. I've also been eating a lot of papayas and pineapples. All those things have enzymes and also have benefits to my immune system and just to my body overall. So that's what I've been using to heal. And I've been sleeping a lot, about 12 to 14 hours a day. The virus makes you tired anyway. Even if you sleep a lot, you're still tired. So I've been sleeping a lot, and I've been praying. I've been praying to God, and my faith has been really, really strong. And I strongly believe that He's helped me, go by and get through this whole thing. From the very beginning, I've been the biggest advocate for social distancing, which I still am now. And that's one of the prime reasons I came out with my story, is I wanted people to know, especially younger people, I want them to know how serious this is and how it can affect them. And they're not invisible, that this affects everybody, no matter your age, and just to take this more seriously.
Right, and uplifting story there from Yvonne Mugure. Dr. Shah, I don't know if you are able to get that clearly, but what would be a comment about her experience?
Yeah, it sounds right. I mean, she had mild disease from her description, and she went to hospital and was given the right advice. She went home and she self-isolated herself, ate healthy, made sure she was hydrated, took the fruits and vegetables that she knew were good for her, and is waiting for the retest. I mean, that's what's going to happen to majority of the patients when we do get the surge in the epidemic.
Right, and on that vein, Dr. Shah, there's a question from Aziz Edo Omuzoa, who is asking, can an infected pregnant woman pass on the virus to their unborn children?
Yeah, a very interesting question, and we don't know the answer to that. I think a lot of studies are looking into that. There has been one case in England where a baby was born with the virus, and it's presumed from the mother. But also remember, there's also hospital transmissions. When hospitals get full of coronavirus patients, there will be hospital-to-hospital transmission in all the wards. So yes, the answer is probably yes. And how much, we don't know. And there are studies looking into that at the moment.
And Dr. Shah, there's a question from Grace Neema in Kenya, and she's asking that she's seen a study that says COVID-19 is airborne. She would like you to comment about that, as well as how you keep yourself safe being a frontline health worker.
So good question. It's something that we in doctors have been discussing for a long time. Is it airborne? So we know it's definitely droplets. So when you cough and sneeze, you definitely transmit. But there are new studies that are coming out that say that maybe just by speaking with somebody, or just being next to somebody, breathing, it may transmit the virus. So we're still waiting on more studies for that. There is one study that shows that it may transmit, and that's why the government has taken the step of saying everybody uses face masks, not just the people who are infected or have a contact. So that's the reason behind the whole country being asked to put face masks. In terms of frontline workers, we use what we call PPE, personal protective equipment. Our hospital fortunately has enough of those for our frontline workers, but still, we've got to be very careful on how we use them. There's ways of using them. There's ways of using these masks. There's ways of putting in the face shield, the gown. So all that education also happens for the frontline workers and all the doctors. And hopefully we're going to be okay. I mean, I know there are hospitals in Europe where doctors and nurses have been infected, and we're very cognizant of the fact. So a lot of training and education has gone on for the frontline staff on how these are worn, what to do, when to wear them, how long you can wear them for, right, and when you should change.
Right. And I mean, there's lots of scenarios, Dr. Shah, but just speaking on the frontline workers, we've all talked about doctors and equipping them with PPE kits and whatnot. But what about their mental health and the fact that these people are dealing with this situation every single day? Are there systems in place within your organization or otherwise that you've put in place to ensure that the mental health of these people is catered to?
So very, very good question. So what we try and do is at the end of the day, we have a debrief. So, all of us sit down and discuss all our patients and see what the issues have been. Is there anyone who's feeling that they can't cope, the anxiety levels? We also have a counseling system in place. We have our hospital counselors who are at the moment just seeing COVID patients and doctors and nurses or frontline staff that manage these patients, and that's helped. I've seen it reduce a lot of anxiety in the patient, also the anxiety in the relatives and the patient. Even that has to be addressed. A lot of mental health. Imagine the patient being in the room for 2 weeks and the only people they see are people who are all masked up in these spacesuits. So even that's hard for them. Luckily for social media, they have phones, they have Skype, we talk to them, without going into the rooms. So there are ways of handling that, but it is a big issue. And as the epidemic does move forward, I think it's something that we'll all have to keep addressing day by day.
And Professor, I just want to hear your comments about the fact that people are really concerned that Africa's health systems are not at par with the rest of the world. We are seeing developed countries struggling. As this epidemic develops, what are your biggest fears?
So my biggest fear is we will not have enough ventilators or critical care beds to look after these patients. I mean, that's a big fear. Having said that, I think our governments put in measures early on, much earlier than Europe and America. So the social distancing, all that. I think those measures came in way before we reached we've had it for 3 weeks now in Kenya, and we've just reached 100 and something patients. So I think our leaders did that correctly. So we hope that with the social distancing and the prevention, we do not get the surge that Europe has got. But I think my main fear is that we also have a young population with HIV. So that's the space we're watching. Would it be worse? We know the condition is worse in patients with diabetes. Whether it holds the same for HIV, we don't know, because the epidemic is just coming to sub-Saharan Africa. So those are my main worries. I think everyone should just stay at home if they can, and until so that we don't get the surge that the West has got.
Indeed,
Right.
There's still so much that health workers like Professor are to learn about this outbreak, how the demographics in Africa affect the spread of
Right.
COVID-19.
Right.
And, with HIV, for example, that's a big concern. 26 million people on the continent living with HIV.
Right, and I guess a lot of issues will be arising, whether it's the policy side, the preparedness as far as health systems are concerned, or just basically obedience and good behavior, as the Kenyan CS calls it, that all this comes to play in terms of protecting and ensuring that everybody is safe in the wake of this corona.
And we can't emphasize that enough,
Right.
because it doesn't matter what interventions are put in place. If you and I cannot adhere to them, if you and I, and we're having cases of one person, the mother gets infected and
Right.
she travels far away to her sister's place.
Right.
In the process, coming into contact with so many people that may be very difficult to trace. It's behavior like
where
this
global
that
leaders as
makes
well
it really
are
difficult.
infected. So I think it goes back to taking a personal responsibility of this is the role that I must do as far as mitigating and flattening the curve, as it were. But it looks like our time is up. I just want to thank Dr. Rina Shah from the Aga Khan University Hospital for joining us and for spending time answering these questions. Thank you very much, Doctor. Also want to thank Anita Asamoah. We've lost her connection. She was an epidemiologist joining us from Ghana, taking all the questions that may be. But all that said and done, protect yourself and others from the infection by simple things: washing your hands and using an alcohol-based rub frequently, and do not touch your face at all costs.
The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's very important that you also practice respiratory etiquette. For example, when you cough into a flexed elbow like this, and practice social distancing. And if you feel that you may have had any symptoms or come into contact with somebody who's a confirmed case, contact the authorities in your country. Thank you so much for watching, and keep safe.